Hi everyone, I am Dr. Sudakshina and I am professor and heading the Chettinad Skills and Simulation Center. And definitely this is an international training center for all life support courses, and we have started off 2024 with a bang because we have courses every day running, and this is the second day of the year and we are full. And on top of that, today we were conducting basic life support, American Heart Association accredited, and we had MDS students as our participants today. And with me I have Dr. Samundeswari, and she is a definitely first year MDS of oral medicine and radiology department. And how do you feel, Dr. Samundeswari? How was the course? How were the instructors? How were the teaching? Did you learn anything today?
First, I have to thank you for this wonderful opportunity, ma'am. We have learned a more basic life support which is needed in day-to-day life and in clinical practice. As an oral medicine and radiologist, we come across many Ludwig angina cases where the patient go to sudden respiratory arrest, where this can be used in these cases. And also the instructors here
you kind of learnt the differences between cardiac arrest and respiratory arrest, and how to handle those cardiac arrest and respiratory arrest, because we had something called rescue breath today, right? So when you are having all these things in practice, hands on, when in the department, basically when you are with the patient, you can utilize these skills and be more confident now. Don't you feel so?
Yes, ma'am.
Yes.
As patient first come to the department or a department, so we can help the patients getting if the patient's having a cardiac arrest in the chair side, and we'll be able to help the patient, and also the instructors here also had patience in teaching every techniques,
skills,
including giving the respiratory, starting from the CPR, and even including that
rescue breath and everything was taught step by step. And you know how to hold a pocket mask now, because you are dealing with more respiratory arrest, because you have so much of growth which is happening inside the mouth. As you are saying, you are oral medicine, right? So you will see a lot of growth in the mouth which can get obstructed. Along with that, if some procedures you have to do, right? So that time it can also lead to a lot of obstruction to the airway passages. So you know how to hold these different airway devices and use them. Correct? Yeah, that was very good. And how was the exam? How did you feel the skill station exam went?
It was very well, and I was able to perform every
skill properly.
And even the exam was very useful because every scenario was unique, and we was able to answer those unique questions, and it helped us more about scenarios, and it was very useful.
Yes, so American Heart Association, we are always supposed to use the scenarios which were given by them in their instructor manual. So we don't create our own scenarios. It is only whatever scenarios are given, we actually kind of trying to do it in the real time. So we simulate those basically, and it is a very professional organization and we have to follow their norms. So that's why we were giving you those scenarios and making you feel as if you are in the real time. That is only simulation, right? And then you get the feel and you start working on the patient as if really the boy has collapsed or the gentleman has collapsed. You got it?
Yes.
So that was the very good part of it, what you brought it out. Yes, they are all based on real life scenarios. How was the theory exam? How did you feel?
Yeah, the theory exam same. It was like every scenario was like unique, and even like teamwork. If it is a teamwork, like how the team should be performing that task. It was so informative too, and it was even like in every scenario we will how to approach those scenario and
take the best possible outcome
to the patient.
You know, to the patient, yes.
That was really
and you will have 2 or 3 options which will be very close to the actual correct option, but you have to select the correct option. Yes, and we have not yet corrected your paper. We are correcting it. So hopefully, definitely you are going to pass, right? And the passing percentage is quite high. But I am very sure you will pass the exams. All the best to you, and thank you so much on sharing your experience today.
Okay, ma'am. Thank you so much.
Thank you.